Welcome to all. In this video we are going to discuss about the cosmetic treatment for acne. First we can go through the OTC product. OTC means over the counter drug. We can purchase these items without a doctor prescription. The first one is benzyl peroxide and second salicylic acid, sulfur containing products, cleansing bars, vitamins, natural remedies. First one is benzoyl peroxide gel. It's best for the pus-filled pimples. It has antibacterial activity, that's why reduce the inflammation and redness of acne. It may cause irritation and itching. Severe case of acne, benzyl peroxide is used with some oral antibiotics. Benzyl peroxide body wash also available. This body wash is used for the body acne and also folliculitis produced by the after waxing in females. Benzyl peroxide is face wash also used for the post-shaving folliculitis. Also useful in blackheads and whiteheads also. Next one is salicylic acid. It's also useful in pimples, blackheads, whiteheads also. It's remove oil from the skin and unclog the pores. The overnight application of salicylic acid avoids better. It may cause irritation. It's also helpful to reduce the pigmentation. Higher concentration of salicylic acid used for the peeling purpose. Next one is sulfur. Sulfur has antimicrobial and also anti-inflammatory property. It helps to reduce the production of new pimples. Its keratolytic activity helps to dry and peel the area where there is a chance to produce new acne. The sulfur containing product is best for the mild acne. Sulfur has mild exfoliating property also. It is useful in mild scar. Better to use a moisturizing cream to prevent over dryness by the use of sulfur. Cleansing bar. Cleansing bar is commonly used for the acne prone skin. The cleansing bar pH is 5.5 to 7%. It is almost similar to the normal skin pH. It is also used to remove makeup, clean the pores and excess sebum and other impurities. Use a moisturizing cream if you feel over dryness. Vitamins also help you to reduce the production of acne pimples. Vitamins are vitamin A, vitamin B3, vitamin C and D, vitamin E and vitamin zinc. Vitamin A derivative creams best for the acne. It is used for topically. Next one is vitamin B3. It is 750 to 1000 mg per day. Vitamin C and D also useful for the acne. Vitamin D deficiencies lead to the acne production. Vitamin E also 400 IU once per day is better for the acne, and also vitamin zinc is 15 mg once per day. Tea tree oil is an essential oil. It has several uses. It is in pure form, very powerful. Don't apply in your face without diluting the pure form. We can dilute with suitable oil or cream or gels. Commonly it's diluted with almond oil or coconut oil or olive oil. 2 drops with 10 or 15 drops of normal oils. This is the dilutions. Oily skin we can dilute it with aloe vera gel also. Avoid sensitive area. Next one, we can discuss about antimicrobial creams and retinoid creams. Next one is azithromycin gel. Azithromycin is 2% is used for the acne. It is an antibiotic cream. The thin layer of the creams applied once daily for acne prevention. It may cause minor burning and irritation also. Next one is clindamycin. 1% of clindamycin used for the acne. It is an antibiotic cream. 2 times per day you can use for the prevention of acne. Next one is erythromycin cream. It's also antibiotic cream. We can apply 2 times per day up to 3 to 4 weeks. These are the steps for applying cream on the face. Clean the face and dry the face. Wash your hand before applying the cream. And apply the cream lightly, thin layer. Don't apply thick layer on the face. Use tip of the finger to spread the cream. Bedtime is the best time to get more absorption of the cream. Next one is tretinoin. It is the vitamin A derivatives. It is used for the pimples, whiteheads, blackheads. It exfoliates the dead cells also, open the pores, decrease oil production and also pigmentation. It helps to penetrate other cream, so it's come with combination like clindamycin and hydroquinone. Always use a sun protection along with the tretinoin. It may cause dryness, redness, burning sensation. Side effect may be caused due to the application of more quantity of the cream, lack of moisturizer in cream, wrong moisturizer, use a strong face wash without application of sunscreen. If side effect is persistent, consult a dermatologist. Next one is adapalene. It is a retinoid cream. It's less irritating than tretinoin. It's exfoliate the dead cells and decrease the sebum production and also oil production. Adapalene is not suitable for dry or eczema prone skin. It's also contraindicated in pregnancy case. Take a little amount of adapalene and dilute it with a moisturizer before applying the cream. Don't apply in the corners of nose, eyes and lips. Use a sunscreen with adapalene. Stop adapalene before 4 to 6 days before waxing, bleaching, scrubbing. Otherwise, it may cause irritation. Next one is a combination of adapalene and clindamycin. Adapalene is a vitamin derivative and clindamycin is a antibiotics. Adapalene prevents the accumulation of sebum and unblock the pores. Clindamycin work against the bacteria. Thank you for watching.